fibroid or leiomyoma. It is the most common benign tumor in the female genital tract. Made partly of muscle tissue, myoma seldom develops in the cervix, but when it does, there are usually myomas in the larger upper part of the uterus as well. Myoma may appear as one large fibroid or many small fibroids. It can range in size from small as a pea to as large as a melon. In general, a large myoma is considered to be 10 centimeters or more in diameter. It affects 20% of women in their childbearing years. In most cases, myomas develop between the ages of 35 and 50. About 10 to 20% of all women over the age of 30 have a myoma. They are very rare before the age of 25. Between 70 and 80% of women develop a myoma by the time they reach age 50. Types of myoma. 1. Intramural myoma, the most common, located within the walls of the uterus. Submucosal myoma grows in the wall on the outside of the uterus. As they grow larger, they can put pressure on nearby organs, such as a urinary bladder, or cause pain due to their size. Third, submucosal myoma grows just beneath the uterine lining and can push into the uterus cavity, causing heavy bleeding and other more serious complications. 4. Transmural myoma develops from all layers of the uterus. Pedunculated myoma develops a small stalk or stem that attaches it to the uterus. The stem may become twisted as the tumor grows, causing severe pain. 6. Intracavitary myoma grows into the uterine cavity. 7. Intraligamentary myoma develops next to the uterus. 8. Cervical myoma, a relatively rare type, develops in the muscle layer of the cervix. It's possible to develop more than one type of myoma at the same time. Small, diameter of up to 5 centimeters. Medium, diameter of up to 9 centimeters. Large, diameter of 10 centimeters or larger. The cause of myoma is not known. Its development seems to be associated with the female hormone estrogen. Myomas appear during the childbearing years when a woman's estrogen levels are high. Estrogen seems to activate their growth. In fact, during the first trimester of pregnancy, about 1/3 of all myomas grow larger, but then shrink after birth. Generally, they shrink after menopause, but hormone therapy after menopause may cause their symptoms to continue. The risk factors include family history. You are more likely to develop myoma if a family member has it. Early onset of menstruation, high weight or obesity, high blood pressure, no history of giving birth. Age appears most often in women in their 30s, 40s, and 50s. Diet high in red meat, vitamin D deficiency. Stress, African American ethnicity, caffeine and alcohol intake. About 25% of all affected women have no symptoms. It is usually only discovered by chance during a routine examination by a gynecologist. The symptoms may occur frequently or occasionally. The disease course varies among individuals. Symptoms may include heavy or abnormal menstrual bleeding or hypermenorrhea, increased and prolonged menstrual bleeding, menorrhagia, bleeding between periods outside the menstrual cycle, or metrorrhagia, pelvic masses, violent pain during menstruation. In the case of heavy bleeding, blood clots can form, the excretion of which is accompanied by cramps. Lower back pain can be severe, episodic, or constant. A feeling of pressure or a lump in the abdomen. Abdominal swelling, distension, or bloating. Painful sexual intercourse. Infertility. Pregnancy complications. Anemia. Fatigue and weakness. Pain, bleeding, or a discharge from the vagina if myoma becomes infected. Difficulty urinating, dribble at the end of urination, urgent need to urinate, or urine retention if the myoma blocks the flow of urine. Urinary tract infections are more likely to develop. A large myoma may partially block the urinary tract or may bulge into the vagina, called a prolapse. Sores can develop on prolapse myoma, which may become infected, bleed, or both. Prolapse myoma also can block the flow of urine. Rarely, myomas can be associated with life-threatening symptoms. Seek immediate medical care if you have heavy vaginal bleeding associated with any of the following symptoms: severe abdominal, pelvic, or lower back pain, confusion or loss of consciousness, difficulty breathing or shortness of breath, dizziness or fainting, pale skin or pallor, rapid heart rate. Diagnosis starts with good history taking, getting important information on family history, menstrual history, and description of symptoms. Medical procedures include pelvic examination to feel for lumps or any abnormal growths, ultrasound to determine size and location of the myoma, CT scan and magnetic resonance imaging or MRI to look at images of the uterus and other pelvic organs. Complications include adverse effects of myoma treatment, early labor, and need for cesarean delivery, urinary tract infections, and pain when urinating when the myoma presses on the bladder or ureter, bladder, bowel, or kidney dysfunction when the myoma presses on these organs, anemia in the case of severe bleeding, sudden stem rotation in a pedunculated subserous myoma causing severe pain and requiring immediate surgery, and problems with fertility or during pregnancy. Treatment. You do not necessarily need to treat myoma if it is not causing any pain or symptoms. Women with myoma will seek treatment because of the severity of the symptoms. Although treatments can range from non-invasive to surgical options, the treatment choice is typically determined by the patient's age, particularly if she is close to the age of menopause, and if the patient wants to have children. Ruling out options such as hysterectomies. The treatment approach also depends on the symptoms and the number, size, and location of the myomas. Most, but not all, women have shrinkage of myomas at menopause. If you are experiencing heavy bleeding and don't want to have a hysterectomy, the options are hormonal contraception, antifibrinolytic, non-steroidal agents, intrauterine device to release progestin within uterus to stop bleeding and pain. If you don't want to have children, endometrial ablation is another option. During this procedure, the endometrium is destroyed using cold and heat. Medications called gonadotropin-releasing hormone agonists, GnRH agonist, can shrink the myoma, but it may grow back once treatment is stopped. Myomectomy, a procedure where a thin tube called an endoscope is passed into the uterus through the cervix. The myoma is shaved and removed. The uterus remains intact. There are several choices for treating myomas, including medications, non-invasive procedures, surgery, or a combination of the therapies. The choice of treatment is based on several factors. Number 1, how severe your symptoms are. 2, the size and location of the myoma or the myomas. 3, whether you may want to become pregnant in the future. And 4, the age and how close you are to menopause. Medication. Mainstream medicine utilizes prescription medications used only to treat the symptoms, while others affect the growth itself. Medications include over-the-counter pain medications, such as ibuprofen or acetaminophen for mild pain and discomfort. Iron supplements for anemia resulting from heavy bleeding. Birth control methods such as contraceptive pills, intrauterine devices, and Depo-Provera can help control heavy menstrual bleeding. Gonadotropin-releasing hormone agonist to temporarily shrink myomas prior to surgery. Drug treatment. There are various options for treating myoma with medication. Progestins control hormones, GnRH analogs, which reduce the body's own estrogen production, or an active substance, ulipristal acetate, which changes the docking sites or receptors for the messenger substance progesterone directly on the myoma cells are used. Progestins are hormones that are also contained in many birth control pills. They are an antagonist of the sex hormone estrogen. Treatment with progestin can slow down myoma growth and sometimes even shrink myomas, which reduces the symptoms or makes later surgery easier. The inhibitory effect of the progestins on the growth of uterine lining can reduce bleeding. Gonadotropin-releasing hormone analogs mimic a specific control hormone for the female hormone balance. Gonadotropin-releasing hormone, or GnRH, it stimulates the pituitary gland to release the hormone gonadotropin in bursts, which stimulates the ovaries to produce estrogen. However, if gonadotropin-releasing hormone analogs are used continuously, the formation of estrogen is suppressed. The myoma is no longer stimulated to grow and may even shrink. Surgical procedures. In the case of a very large myoma, severe symptoms caused by the benign tumor or multiple myomas called uterus myomatosus, surgery is the treatment of choice. Even if it is not clear whether it is a malignant tumor like sarcoma, surgery is still necessary. In most cases, the entire uterus is removed, called hysterectomy, either to the vagina, rectum, or abdominal incision. If the myoma is small and the woman still wishes to have children, it is also possible to remove myomas in isolation. This is done by removing myomas or myoma enucleation. Depending on the type of myoma, different procedures are possible. Depending on the size, location, and number of myomas you have, invasive surgical options include laparoscopy, a surgical procedure that uses small incisions and an instrument with a tiny camera to remove myomas that are easily accessible. Uterine fibroid embolization, or UFE, a radiology procedure that uses injections to cause myomas to shrink and sometimes die. However, this is not yet done locally. MRI-guided ultrasound surgery, a technique that uses ultrasound waves to shrink or remove myomas. In more severe cases, you might need to consider a more invasive type of surgery. These include hysterectomy is a surgery to completely remove the uterus. It means that you will no longer have the option of getting pregnant in the future. Myomectomy is a surgical procedure that requires a large incision in the abdomen to remove the myoma without removing the uterus. The person still has the uterus and might be able to get pregnant in the future. There is also a risk that the myoma will recur. Some lifestyle changes that might help you cope more effectively with symptoms and improve your overall health and wellness, including dietary changes, exercising, managing your stress levels, losing weight if you are overweight or obese. Pregnancy. In principle, a myoma is not an obstruction to pregnancy. Only in rare cases does infertility occur in affected women. For example, if the myoma lies in front of the fallopian tube, during pregnancy, a myoma can cause various problems. As estrogen-dependent tumor, myoma grows faster in pregnancy because the body then produces more of the sex hormone. Due to their increasing size and location, myomas can cause pain, positional anomalies of the child, such as breech presentation, or block the birth canal, in which case a cesarean section is necessary. Premature labor can also occur. Myomas have been shown to increase the rate of premature birth and miscarriage. If the myoma grows directly under the lining of the uterus or in the uterine cavity, this can lead to ectopic pregnancy as well as miscarriage. Contrary to earlier assumptions, experts now no longer believe that cancer can develop from a myoma. Recent studies suggest that sarcoma develops independently of a myoma. Nevertheless, regular checkups should be carried out in order to detect and treat myoma complications at an early stage. According to Dr. Feredun Batmanhelij, author of the book Obesity, Cancer, Depression, Their Common Cause and Natural Cure, a tumor is a result of a lasting deep dehydration in the interior of the cells. Dr. Batmanhelij claims that there are 4 physiological dysfunctions that lead to tumor formation, and these physiological dysfunctions are the results of unintentional chronic dehydration. When a person goes into a state of chronic unintentional dehydration, 66% of water inside the cell is lost. 26% of water outside the cell is lost, and 8% of water in the blood is lost. The 4 physiological dysfunctions are as follows. 1. Damage to the DNA. 2. Reduced efficiency of the DNA repair system. 3. Receptor downregulation. And 4. Suppression of the immune system. The first physiological disruption is DNA damage, a prerequisite to tumor formation. The human body is composed of about 100 trillion water-dependent cells, each endowed with the same genetic secrets of life. Just as a drought threatens the survival of the local vegetation, a drought in the interior of the body threatens the survival of the cells in the drought-stricken areas of the body. Pain is the cry of the genetic pool in the drought-stricken area that cannot be washed and cleansed from the destructive toxic waste accumulating in the locality. Fortunately, the body possesses a strict water rationing program that delivers some water to preserve life, but not enough to completely flush off the toxic acidic metabolic waste. One of the vital functions of water is to eliminate acidic metabolic waste and toxins out of the body. With insufficient amount of water, this metabolic waste accumulate to a certain acidic level, and this state damages the gene pool. Normally, the kidneys regulate the balance between acid and alkaline states of the body fluids, provided they receive enough water to produce adequate volume of urine. The pH in the interior of the cells is regulated at 7.4, an alkaline state. When the body becomes more and more dehydrated and urine production is diminished, the mechanism of acid-alkaline balance becomes inefficient. The acid is not collected from some of the areas outside the emergency water distribution programs, and when it stays and builds up in the cells, it damages the vital structures in the cell. This is when DNA damage takes place, repeatedly and often. The accumulation of the acid eventually destroys the cell and outpaces over the capability of the DNA repair systems and the quality control processes installed in the cells. This imbalance causes the transformation of the DNA. The onset of dehydration might be established with inadequate water intake, intake of wrong beverages, such as the commonly favored commercial beverages that are mostly laden with caffeine, intake of diuretics, such as furosemide, spironolactone, and hydrochlorothiazide, and the intake of alcoholic beverages. Reduced efficiency of DNA repair system is the second physiological dysfunction. When the body becomes dehydrated, insufficient raw materials are delivered to make the repair of the damaged vital parts. The transport of essential nutrients and oxygen to the various systems of the body is another vital function of water. When the cell runs short of the raw materials needed for the repair, the body has to release some of its stored elements and use them on an emergency basis in whatever capacity they can function. As the part of this process, proteins are broken down and their amino acids are recycled and used. Several amino acids are used as antioxidants that neutralize the acidic toxic waste. This process results to the gradual depletion of amino acids, and one of the most important amino acid is tryptophan. Another amino acid sacrificed as an antioxidant is tyrosine, the building block for a number of excitatory neurotransmitters. Tryptophan, when coupled with two lysines, form a tripod enzyme that has an intricate role within the quality control system of the DNA transcription process. This enzyme cuts and splices transcription errors in newly formed cells. Lysine easily gets damaged when the body gets dehydrated. Thus, the depletion of tryptophan reserves resulting from dehydration can contribute to tumor formation, since the enzyme that checks the formation of aberrant DNA is prevented from working. Receptor downregulation is the third physiological dysfunction. This process is a gradual erosion of the controlling systems that would normally prevent ongoing deviations from the norms of the body. The human body utilizes special kinds of receiver proteins on the membranes of the cells that constantly receive specialty coded chemical messages that get attracted to their messenger-specific receptors in their fluid environment. The purpose of the union of the messenger chemical with its receptor on the cell membrane is code-specific communication with the command centers in the brain. It tells some groups of cells to act or stop activity. The reason for the so many different chemical messengers for different sets of cells. The presence of adequate messenger-specific receptors on the membrane of a cell is prerequisite to its normal operation. A healthy cell is well equipped with protein receptors on its membranes. The health of any cell depends on its rate of protein production against its recycling process of protein breakdown. There are two kinds of protein-specific enzymes. The kinase group of enzymes engages in protein manufacture, and the protease group engages in the breakdown of proteins. In dehydration, the cells begin to recycle some of the protein reserves of the body. To do so, protease activity and the rate of protein breakdown will overtake the rate of protein production. The proteases become mobilized, initially breaking into the protein structures within the cells of the water-deprived areas and the liver, and eventually attacks the larger muscle mass in the body. The protein structures of the cells include receptors on their cell membranes. These receptors include the boundary sensing proteins that would stop the cell growth into the neighboring cell's physical space. With the loss of such sensors, the potential tumor cells grow disproportionately into large, irregular lumps. At the beginning, this kind of growth may remain benign. Protein kinase C is a large-sized protein-making enzymes connected to the DNA transcription process. It is found in normally active cells. It is responsive to the on-off switching processes within the cell. It is integrated in the physiological roles of the cell in its residing organ. Normally, this kinase is efficient when the primary amino acids it works with are sufficiently available in the body and adequately present in the cell. It uses the amino acids for the manufacture of essential components of the cell, such as its membrane receptors. The membrane receptors provide personality, culture, and knowledge on the cell. Cells that are supplied with a full array of receptors are educated and sophisticated cells. These fine-tuned cells with their specific roles are cells that respond to the needs of the organ. When the proteases begin to break down the receptor components of the cell, they also break down protein kinase C, creating a new kinase protein, kinase M. Protein kinase M is half the size of protein kinase C and is totally disobedient to the on-off calls of the cell. It is an autonomous protein-making enzyme that gets gradually phased into the daily life of the cell. This is when the cell regresses into its earlier primitive form of itself, losing its sophistication and its status as an integrated member of the local cell community. Now, it is only obedient to its selfish genetic drive to survive at any cost, much like the primitive single stem cell life, the form at the start of life, a breed of genetically selfish cells with a powerful will to survive in their hostile, low oxygen, and acidic physiological environment. Later, these cells acquire sophistication and secondary characteristics compatible with their new environment, the hostile, low oxygen, acidic state. Suppression of the immune system is the fourth physiological dysfunction. Dehydration directly and indirectly suppresses the immune system of all places at the level of the bone marrow. In the indirect suppression of the immune system, when histamine acts to regulate the available water along with the essential nutrients water should carry, quite a number of ruthless subagents are commissioned to modulate the events. The first thing that happens is the increased release of a chemical called vasopressin. This substance has a dual role. It immediately causes some membrane receptors to transform into porous, showerhead-like sieves with holes only wide enough to let water molecules without any of the osmotically held elements to go through the holes, single file, one at a time. This filter system is designed to hydrate the most vital cells in the body, the brain cells, liver cells, the kidney cells, the gland cells, and more. Vasopressin also creates added constrictive pressure in the capillaries and causes forced filtration and injection of freed water from the blood into the cells in its areas of operation. The mechanism delivers water into the cells by the process of reverse osmosis. This process, however, makes the consistency of blood more concentrated and thicker. The manufactured free water can now perform vital, life-saving work inside each cell in the drought-stricken areas. In the kidneys, vasopressin helps retain water and concentrate the urine. Vasopressin's function of forcing water to the cell membranes is its primary role. Its secondary function is to act as a very strong modulating cortisol release factor. It influences the adrenal glands to release very potent hormones such as cortisol, cortisone, corticosterone, and aldosterone that initially prevent inflammation and also force the kidneys to retain salt 1,000 times more forcibly than normal, thereby expanding the body of water in the environment around the cells so that more can be filtered and injected into vital cells. Cortisol and cortisone are strong anti-inflammatory agents. They exert this action by suppressing the immune system via the activation of agents such as interleukin-1. The actual damage is done when interferon production is arrested. Interleukin-1 is a potent immune suppressive neurotransmitter and activator of tissue breakdown. It inhibits interferon production. Histamine has dual roles as a water regulator and immune system activator. When histamine engages in its water regulating capacities during unintentional chronic dehydration, the immune system has to be disengaged. Otherwise, water shortage in the body would cause a flare-up of the immune system without any need for its overactivity. The role of interleukin-1 in tissue breakdown is compatible with the need to release some resources from the tissues of the body from cannibalism of the body's own tissues to the point of causing autoimmune diseases. Why does it inhibit interferon production? In inflammatory conditions, the affected area is shut off from free flow of circulation, thus oxygen. The swollen, inflamed region becomes overcrowded with defending white blood cells to the point of pus formation. The oxygen supply from blood circulation cannot keep up with this rate of use in the center of the inflamed area. This is where interferon reveals its vital role. By acting on its receptor, interferon stimulates an enzyme that causes substantial production of ozone and hydrogen peroxide from tryptophan and its family of indolamines. These have a great affinity for storing oxygen and converting it to superoxygen. Hydrogen peroxide and ozone act as local antiseptics against bacteria and anaerobic tumor cells. Some free oxygen is also provided for the stranded white blood cells in the middle of the inflamed and isolated area. This is how interferon normally acts as a natural and vital anti-tumor chemical in a properly hydrated body. In early dehydration, interferon flare-up without justification is not needed. Yet, this indirect but very potent mechanism of interferon shutdown by histamine is why chronic dehydration is the primary culprit in tumor formation. The human body, under normal circumstances, has all the faculties to prevent transformed cells from becoming a tumor, but only if it does not fall into the chemical abyss of dehydration. The defense system of the body depends on the precise action of its white cells. There are 6 different types of white cells: neutrophils, eosinophils, basophils, monocytes, lymphocytes, and plasma cells. The lymphocytes constitute about 30% of all white cells in the body. Most white cells, much like constantly cruising police cars, leave the blood circulation and enter into various tissues to bolster the state of local defense system. Then, they re-enter the blood circulation via the lymphatic system. Some white cells become fixed local protective shields until used, and then replaced. Lymphocytes are mostly responsible for the manufacture of antibodies to offending agents, whereas the other white cells engage in eating and digesting dead and dying cells, as well as intruding elements. The lymphocytic line of defense attach themselves to the element that is recognized as an outsider, such as bacteria, viruses, parasites, and not only neutralize their toxicity, but also label them for scavenging cells to devour and digest. The lymphocytes that need to engage in antibody formation get programmed in the thymus gland, possibly in the liver, and definitely in the bone marrow. The ones schooled in the thymus gland are called T cells, and those from the bone marrow, B cells. T cell lymphocytes are divided into 3 types, namely the helper T cells, the cytotoxic or killer T cells, and the suppressor T cells. Among them, these T cells regulate immune system via the chemical agents they produce, such as interleukins, interleukins 2 to interleukin 6, interferon, and stimulant factor for growth of the other white cells. Histamine is also a major regulator of the complex roles of the white cells in the operation of the immune activity when there is a genuine call on the immune system. However, the system did not, and indeed must not, become activated by histamine when it engages in the drought managing programs of the body. The immune system is suppressed by histamine in the bone marrow, where all the immune activity of the body originates. Suppressor cells are highly responsive to the action of histamine, There are twice as many suppressor cells as helper cells permanently residing in the bone marrow. Additionally, the suppressor T cells in the circulation also sequester to the bone marrow once stimulated by the histamine. Thus, histamine puts a tight lock on the bone marrow activity through its strong influence on the larger local population of suppressor T cells. This is how histamine prevents flare-ups of the immune system at its bone marrow origin when it gets engaged in the drought management programs of the body. Not only does proper hydration apply to the prevention of diseases such as tumor and the autoimmune disorders, but it also highlights how gradually and yet surely shortchanging the body from water it must receive daily is an invitation to disaster. Dr. Batman-Hellich claimed that water can reverse more than 90 major and minor health problems. I hope that you have understood how chronic and intentional dehydration contributes to the cause of myoma. Steps to remission. While the body is alive and has the will to survive, it is possible to reverse disease processes. The body is a complex chemical plant that works with what you give it. Give it the right ingredients and it will grow along as it is designed to do so. Give it the wrong ingredients and you force it to dangerous chemical pathways that manifest the symptoms and signs leading to a disease. When the body is given the best ingredients, vibrant health will once again be restored. This is when the disease processes go into remission. Repeat the same mistakes and you will reap the same harvest. Disease. This is when tumor recurs. Don't make the mistake thinking health problems are cured by cytotoxic medications, chemotherapies, surgical procedures, or radiological protocols. The disease process continues if the internal chemistry of the body is not optimized by the ingredients you give it. Thus, resolving tumors into remission is possible only if the right steps are taken. Some important steps one should take are the following. First, attitude. You need to generate the chemistry of a body that is determined to fight. With the regenerative powers of hope, you will be able to direct the defense system of your body towards survival from any naturally reversible health problem. According to Dr. Batman-Hellich, tumor is a truly reversible health problem. Second, water. Water is the most important substance for life. If there was no water, oxygen would not be able to reach the deepest corners of the cells. It is true that oxygen is used in the composition of water, but as a primary substance only. Water is more important for the prevention and cure of all sorts of health problems, and most especially to tumor. You have to prudently prevent dehydration. You must not wait to get thirsty in the traditional sense of developing a dry mouth before you drink. Dry mouth is not an accurate indicator of early pathology-producing thirst. A good indicator is the color of the urine. Drink enough that urine fluctuates between perceptibly light yellow and colorless. To hydrate the body properly, follow the formula: 50 milliliters per kilogram body weight per day. The adult human body is approximately 7% water, and so the old rule that we must drink 8 to 10 glasses a day is very erroneous. After computing for the right volume of water to drink, this is the manner that one should drink water throughout the day. 1/4 of the total daily water requirement is taken upon waking up in the morning, and at bedtime. 1/8 of the total daily water requirement is taken 30 minutes before lunch and supper. 1/8 of the total daily water requirement is taken 2.5 hours after breakfast and lunch. Drink additional 250 ml of water for every 30 minutes of any strenuous physical activity. Drink whenever thirsty. Drink purified drinking water purchased from an accredited drinking water refilling station or water filled through a drinking water system certified by the National Sanitation Foundation or NSF International as Class 1 for standards 42, 53, 58, and 401. The major contaminants in water are sediments, microorganisms, chemicals, and heavy metals. These contaminants must be eliminated from your drinking water to avoid any adverse health effects like tumor formation. Since most purification technologies eliminate the healthy minerals, they must be restored utilizing Ionique mineral drops. Water without minerals is acidic and dead, and it cannot hydrate the body properly. For more information, you may visit www.ioniqueminerals.com and read my article on proper hydration. It will guide you on how to hydrate your body effectively. Third, minerals. A balance of minerals in the diet is crucial to prevention and treatment of tumor. You need minerals to expand the volume of blood in circulation so it stays diluted and reaches all the corners of the body. Minerals also help make the inside of the cells alkaline, essential for preventing and treating tumor. For adequate mineral supplementation, I recommend Ionique mineral drops, manufactured by Mineral Resources International or MRI, because it is 100% natural, potent, ionic, and contains at least 72 health-giving macrominerals and trace minerals that provide sufficient alkaline minerals to prevent and correct acidity. Several studies have revealed that regular intake of magnesium, selenium, zinc, iodine, etc. have offered impressive benefits to tumor patients. I recommend 100 drops of Ionique mineral drops and 60 drops of our elemental selenium daily. To avail of these elements, please visit www.ioniqueminerals.com. Fourth, green vegetables. The green color of vegetables is provided by chlorophyll. Chlorophyll contains much magnesium. In the same way, hemoglobin contains much iron. They are both oxygen carriers. Chlorophyll has the effect of making the body alkaline. Green vegetables contain many vital elements needed to sustain life, such as vitamins, minerals, proteins, essential fats, antioxidants, and phytochemicals. Examples include ampalaya, bok choy, broccoli, Chinese pechay, green papaya, kale, kangkong, lettuce, malunggay, okra, pechay, upo, saluyot, sayote, spinach, string beans, and various vegetable tops or talbos. Fifth, fruits. Colorful fruits and berries have many antioxidant properties. They make the body alkaline. Fresh fruits prevent free radical damage. The body can meet many of its mineral needs, such as potassium and calcium, via fruit. Citrus fruits, green mango, tomatoes, avocado, melon, and more are God's medications for a sick body, especially for a tumor-stricken body. Have several servings of them every day. Other good examples include berries, buko, dragon fruit, guava, guyabano, pomelo, strawberry. Avoid fruits that turn yellow when ripe, such as ripe mango, papaya, banana, and jackfruit. Their sweetness may further promote tumor growth. Avoid imported fruits such as apple, pear, oranges, kiwi, etc. because they are usually laden with pesticides and other agricultural chemicals that may trigger tumor formation. Sixth, proteins. Proteins are essential as building blocks for the physical structures of the body. They are also used for the manufacture of enzymes, receptors, and neurotransmitters in the brain. Proteins tend to make the body acidic. Thus, there should be a balance between the amount of fruits and vegetables in the diet and the protein intake. An ideal composition is around 80% fruits, vegetables, and legumes, which are high in protein, and ideally balanced in amino acids. Protein taken must always be with a balanced amino acid composition. Legumes such as lentils, chickpeas, green peas are about 20% protein. Only 20% of the protein in diet should be from other sources such as eggs. Our offices provide lists of foods and beverages classified altogether as our special diet, and you can have it for free. Just visit FB account Ionique Minerals Philippines and request for the list. Seventh, exercise. Exercise is one of the physiological pedestals on which life stands. It helps blood circulate in all corners of the body, hydrate and oxygenate its region, and preserve local health. Proper regional hydration and oxygenation of tissues are sure steps to tumor prevention. Exercise is vital for efficient lymphatic flow back to the heart. Muscle contraction exerts pumping pressure and forces the lymph to flow into the lymphatic vessels upward and onward to reach the heart and get mixed with blood to be circulated again. Exercise will direct body physiology toward conservation of tryptophan and the other essential amino acids, vital for prevention of tumors. Eighth, sunlight. Sunlight and its subset of light systems reaches and stimulates special sensors of the skin of the face and the forehead, as well as the light sensors of the eyes. These energy fields of light program and set the biological clock of the body to naturally integrate the hormonal secretion of its glands. Sunlight is a healing energy. Sunlight converts cholesterol to vitamin D and encourages storage of ATP energy in the calcium deposits within the cells of the body, a vital step in boosting the immune system activity of the body. I hope I have discussed how proper hydration and adequate mineral supplementation may help you conquer myoma, especially at its early stage. Should you need to learn more, please feel free to visit any of our branches and product distribution outlets. Our staff will be more than willing to assist you. If you are blessed by this video presentation, please share it with others so they may be blessed as well. Thank you very much for spending your precious time with me. Until we meet again, may the good Lord bless you all. Please stay safe, everyone. Once again, I'm Dr. Renato Paragas, the Water Doc.
Na si Brother Bo Sanchez hinggil sa ating Water Doc, Dr. Renato Paragas.
You know, we want to be healthy, but guess what? The blessings are already